Okay, well, good morning, good afternoon, good evening to all of our attendees. Thank you for joining us today on the Telemedicine, Pathogens, and Future of Healthcare Roundtable. I'm fortunate to be joined by Helen Crampin from Innovate UK, John Banta from Blue Cross Blue Shield Ventures, Jessica Zeski from Echo Health Ventures, Cassio Spina, who's a lead partner at Altivia Ventures, Derek Arts, who's the CEO and founder of Castor, and Douglas Hansen-Luke, who's from Future Planet Capital at Barclays. I wanted to open this roundtable by just starting off giving a little context. We're talking about sort of healthcare and the future of healthcare in the COVID-19 era. COVID-19, as we know it, has upended our modern lives in ways that I think we're still trying to understand and just beginning to understand. The top 20 countries by GDP all implemented some form of social distancing and quarantine, representing about 80% of global GDP in aggregate. And 93% of the world's 193 countries as of April this year had already reported cases, with each person expected to infect an additional 2 to 3 people. So we're living in an unprecedented time, and I think what we'd like to jump into, just to kick off then with that context in mind, is an introduction from each of our panelists, along with some context around your current investment thesis or themes, areas of interest that are relative to the topic of this panel. So I'd like to start with Helen, please.
Hi everybody. Yes, so my name's Helen Crampin and I'm the innovation lead for the Healthy Aging Challenge at Innovate UK. So for those of you who don't know, Innovate UK provide government-backed funding into R&D across a whole wide range of areas. My focus is healthy aging, as I said, and I actually run the investment partnerships program, where we are entering into partnerships with private investors to catalyze innovation around those 7 themes of healthy aging, which I think you may have seen in the information. We've already seen 13 million allocated to our current investor partners, who are Barclays Ventures, Legal & General, and North Star Ventures. And we've got another 16 million left to deploy over the next year. So we are currently looking for more investors to work with around these themes of healthy aging. From the point of view of COVID, and I think we'll obviously get onto that specifically a bit later, my job hasn't changed at all. It's business as usual because I work in healthy aging space and it's all about healthy aging right now. Unfortunately, there are many connotations around that, which again, we'll discuss. So that's me, really.
Great, thanks, Helen. And John, can we go to you, please?
Absolutely, Sarah. Thank you, and many thanks to GCV and Masonia and to all of you. And it's great to have an opportunity to engage and interact. We'd prefer to be in London, but it's great to be together with everybody in a setting like this. So for those unfamiliar, I'm the managing director of the Blue Venture Fund, which is the captive fund family that invests on behalf of the Blue Cross and Blue Shield companies, of which there are 36. I think everybody in this group knows that in the US, we have this sort of hybrid public-private multi-payer system. And within that, Blue Cross Blue Shield is sort of an odd beast with probably little corporate analog elsewhere. It's actually 36 sort of independent health insurance companies that are federated together through a common license of the Blue Cross and Blue Shield brand. So we have about 109 million members and represent about 1/3 of the country here in the US. Been at it for about 12 years. We were very, very fortunate and grateful to have raised a 4th fund sort of in the midst of all this. And so have about 850 million under management and have a pretty unique model collaborating with the governance folks on various plans, an independent company here in Chicago called Sandbox, who collaborates exclusively with us. And we often co-invest with the direct investment groups at our plans, including groups like Jessica's, who I'm thrilled to be on the panel with today. So a bit of a similarity to Helen, our overriding themes are generally in 3 areas that address problems of strategic relevance to the Blues plans. Tech-enabled service on the one hand, plan infrastructure secondly, and then we have kind of a growing clinical practice, not so much in therapeutics, but in diagnostics and particularly precision diagnostics. This current crisis has kind of highlighted some of the things we've been at for a long time. To begin with, it's obviously been a sort of a forcing factor for and a catalyst for virtual delivery of really any kind, not just telehealth, but all kinds of mobile forms of delivery, including remote patient monitoring and sort of the shift in the site of care or even hospital level care to the home. And those are all things we've done for a long time. If anything has been sort of heightened by this, it's our renewed commitment to try to address inequity in the healthcare system. We've long had this dialogue around social determinants, and it's been difficult to find actionable ways to address that. I don't think anybody's left that doubts that it's crystal clear that there's a relationship between social determinants and health outcomes. And of course, ironically, the events of the last week also demonstrate that there's some socioeconomic factors that affect non-health outcomes. But for us, this means a number of things, particularly helping our plans serve economically challenged populations, particularly in Medicaid, and leveraging analytics to better identify who is vulnerable that needs different versions of help. So ultimately, these things are all sort of correlated. Faster adoption of these new models means interesting opportunities to do things a little bit differently, maybe, including the way that we handle the relationships with our providers, particularly independent providers, and get more aligned around the idea of generating good outcomes for our members. So that's what we've been up to.
Great. Thanks, John. That was super. Jessica, we're going to move on to you.
Yeah, great. And John gave a great lead in. I'm Jessica Zeski. I'm a partner with Echo Health Ventures. We invest on behalf of Blue Cross of North Carolina and Cambia, which John already said, the Blues are very unique insurance and provider of innovation in across the U.S. We're really looking at two very innovative plans, looking at value-based care and the role of consumer. Of course, COVID has refocused a lot of our efforts and refocused our CEOs to be dealing with the crisis in front of us. And on top of that, now more, as again, John mentioned, the racial and inequities issues that are becoming even more apparent. They're always present, just being more talked about now in America. So how does healthcare play a role in this? How is COVID actually exacerbating some of those issues also? We're looking quite a bit at new models of care and care delivery. I think that's more and more looking at what does that look like in the home? What does that look like when you don't have a safe place to go to the clinic? And what does those new models look like? We're continuing to look at the financing of care. I think as we look forward, and the health wealth, a really touchy issue in the US healthcare system. And as we look at more in the midst of a pandemic, how to pay for care is another issue that we're going to be continuing to look at. And then the navigation of all of this, and what tools can we start to use? And I know we're looking at those across the world in terms of how do you translate things easily? How do you get best practices? How do you get those disseminated, that type of information quickly disseminated also? So that's a quick intro for Echo Health Ventures, and I'll turn it back to you, Sarah.
Great, thank you. Cassio.
Thanks, Sarah. Nice to get with all of you. I'm Cassio Spina, founder and lead partner of Altivia Ventures. We are based in São Paulo, Brazil, and we invest in the digital health sector. It can be anything from telemedicine, telehealth, from AI or analytics, anything that can help getting better services for the patients. That we are a major focus. We can invest globally in any startup, but what we're looking for is startups that are focused on developing their business in Latin America, where we can help them get into the market. I think it is the value added we can do besides the investment amount. We usually do seed investments to Series A, and we would like very much to do co-investments with other funds, especially for overseas startups that we think that it's important to have some more close investor locally on them.
Super, thank you, Cassio. Derek.
Yeah, thanks, Sarah. Thanks for inviting me, and very happy to be here with everyone. So yeah, I'm Derek Arts, trained as a medical doctor and PhD, founder and CEO at Caster. During my medical training, I realized that medical research is basically stuck in the 1980s, not at all leveraging the power of data or technology. And it's basically a process that is relying on a lot of manual work and free text publishing. And so I set out about eight years ago to help solve those issues. So we've built a platform that supports researchers globally with capturing data for research, because ultimately I believe that facilitating that process and making that data reusable and making the data machine readable will allow us to start automate clinical trials, to support data reuse. So we avoid reinventing the wheel, but more importantly, we're actually able to put data together to help drive medical decision making. And currently we have over 4,000 running projects in our platform that cover a broad range of disease areas, basically any area where research is being conducted. And for us, ultimately, what we're trying to achieve is to enable the world to make their research data machine readable, and to be able to leverage artificial intelligence across standardized research data set. For us, COVID has been a very interesting time, because I think crisis like this really calls for a concerted effort to capture high quality data that is quickly made reusable, so that investigators from all across the globe can benefit from that data and tie it into their own research. And so we've been at the forefront of that movement. We've made our platform available for free for any COVID-19 research in any country in the world. And so today we're supporting more than 180 COVID-19 studies, which also includes the WHO Solidarity mega trial that's running globally. And right now we have more than 5 million COVID data points on the platform. So for us, it's really been about making sure we support these researchers in capturing data for their research projects, but also enabling them to make that data reusable, so that others can also benefit from it, and we can accelerate the process to find a cure or a treatment and a vaccine against COVID-19. And on the technology side, from the business, we see accelerated adoption of innovative technology that we've been developing over the past years. So things like e-consent, remote monitoring of patients, and of course also an increased focus on reusing any existing data, such as data in EHR systems. Because being able to reuse data also means you don't have to go to a patient, or a patient doesn't have to come to the hospital to generate or capture that data. So I think in that sense, it's an amazing time for innovation, as I think all of you recognize, both the panelists and the attendees. And very happy to today reflect on that, and also reflect a little bit on, do we expect these changes to last, or do we think it's going to be temporary? Because I think that's going to be a very interesting discussion. Will we ultimately also see some kind of benefit come out of this crisis that's affecting so many people in a negative way? So happy to be discussing that today.
Yeah, super. You had a lot of points that I think we're going to get to in our discussion. Is Douglas with us? Yes, Douglas, here we are.
Sarah, thank you very much for bringing us together in GCV as well. It's very kind of them. So Future Planet, we're a global university venturing fund and investment platform for co-investments as well. So we're investing in growth stage companies that are coming out of the different universities that we focus on, 10 centers of innovation. And we're looking to invest in companies that make a difference to climate change, health, education, security, and sustainable growth. So we're a challenge fund. And like Helen, we're working with Barclays at the moment. So particularly on health, we're working on a up to $50 million allocation for those spin-outs, growth companies that are actually making an active difference to infectious diseases. So not just COVID, but also to the ones that may come later. COVID itself is dreadful, and we've seen the damage it's caused to the global economy, but actually it's one of the less infectious diseases that are out there, and they could be much worse. So we certainly see the need to identify quickly for the current crisis, identify companies that can work on prevention, can work on cure and treatment, and also on services and diagnostics. So they're the areas that we're looking at. We do have a slight interest as well in aging well. The chairman of our advisory fund, Norman Foster, is 82. So he's always very interested if at the same time we can look at the age-related side. But actually, quite seriously, the age impact of this is very important. So under the age of 65, there have been no more than 300 deaths in the UK from COVID out of 30,000. So I think there is the genetic side, there's the racial, there's the social economic, but actually this is a crisis now which really emphasizes the importance of longevity and investing around areas that can actually address the challenges of that as well as infectious diseases. So there are two major themes for us right now, clearly.
Super, thank you. And I'll go last, but hopefully not least, Sarah Fisher. I'm the moderator of this panel. I work as an external innovation for Johnson & Johnson, based in Amsterdam, the Netherlands. JJ has a 134-year legacy in healthcare and a long history in being at the front lines and supporting frontline workers in virus and pandemic-related work. Currently, as many of you know, we have a vaccine candidate that is being developed in collaboration with BARDA in the US, as well as Beth Israel Deaconess Medical Center. We expect our human trials to begin in September of this year, and hopefully have availability for distribution of this vaccine in early 2021, with a commitment to providing 1 billion doses under the emergency use authorization. We're also collaborating with a bunch of other strategic partners on screening the existing medications for applicability in current treatment. We've donated 50 million to the frontline workers, just under 4 million in PPE in China at the start of the outbreak. Although we're not a manufacturer of PPE, we did help fund that effort. Our global incubator program, JLabs, has a financial relief program ongoing at the moment, supporting companies within the structure of our JLabs programs, 45 of which are relevant COVID-19 companies. And our Washington, D.C. Location is very much focused now on kicking off efforts around pandemic preparedness. We have a bunch of other things that we're doing to support this effort, even in terms of providing employees, relevant medical background employees who want to get back to the front line with 14 weeks of paid leave so that they can contribute again in their communities. But what I'd like to shift to now is really talking about investment in pandemic preparedness and the future of healthcare. We have seen during this time unprecedented speed of collaboration. I think, Dirk, you were alluding to some of this as well. In terms of global information sharing, it's usually 20 times the norm on COVID published papers that we would normally see at this stage of disease. Rapid mobilization of clinical trials. I think the number of registered COVID-19 studies, according to Statistica, as of May 28, 2020, are 1,783 worldwide. And we're seeing regulatory bottlenecks being removed to allow for speed and efficiency in the space of research and supply chain, et cetera. We have also, though, seen some great inefficiencies, which I think you all were focusing on and calling out. Rapid result point of care diagnostics, insights from dark data in the medical record, telehealth, is it here to stay? Teledoc reporting some strong growth, and we've not moved much from the in-person DX to treat models for over the last 100 years. Maybe since the Spanish flu, not much there has changed. Connected devices and automation and AI. So I'd love for someone, give a call out maybe to John, if you might even be interested in taking the lead to kick us off. You know, there's a lot of information and what we're doing well and where we have room to improve, and talk to us about some of the areas that I might have mentioned or others that you feel are an important focus
Sure.
this time.
So we got a lot of topics there. Let me hit on a couple of them. I'll start with telehealth maybe, and just, where we see it, where I see it going, where we see it going. So I would think of it more broadly as sort of virtual care generally. It's more than just telehealth. It's really anything about helping us serve members where and when they want to be served. And, this forced experiment has changed a lot of attitudes, not just the attitudes of docs and payers, but all of us as patients. It's a great experience, and we didn't all access it before. Now we know how nice it is. And there's a lot of ways to do that. All modalities of digital care management, whether it's text and email and chat or mobile care teams, are all interesting, not just video. And it includes, as Dirk mentioned, things like remote monitoring and hospital at home. With this early effect we saw, having a couple of % of utilization go to even the majority of delivery in some areas of specialization being virtual, was really impressive. I think the jury's still out on what the level of uptake will be when we settle back to a new normal, but I find it really hard to imagine it's not going to be meaningfully higher than before, now that we've begun to overcome some of these regulatory and adoption and other reimbursement and other challenges. It's not a new theme for us. We've been at this for a while, and the way we typically did it in the past is we'd find episodes of care where new virtual delivery models could be interesting and improve things, and behavioral with Able2, and substance misuse with WorkIt and others. And they would the patient be referred out to these companies as sort of part of their provider network. One of the phenomena that we're encountering now that I think we all collectively will need to address is patient experience is now very inconsistent. As people are encountering payer-provided solutions and now their favorite docs have solutions, the experience is getting kind of disparate and inconsistent. So there's an opportunity there, I think, to get the platforms together and unify the experience in terms of how our patients encounter it. But going to this broader topic of, how do we learn on what we just saw and what we're still seeing in terms of the overall system? Yeah, obviously there's a lack of resilience in the healthcare system everywhere, not just in the US. And we need to be able to operate in the midst of a pandemic with safety for healthcare workers and for patients. I don't think in the US we still have a public health infrastructure that can test and trace and isolate those that have been affected in a meaningful way. One thing you don't see talked about a lot that I think is important is kind of how we change our approach to congregate living situations, whether it's housing or essential workplaces or colleges. I've got a couple of that are going to be heading back or heading off for the first time. No great arrangements in place. And other threats, simultaneous threats that come up, things like the unrest and protests in the last week. We just don't have good means of dealing with that. So you mentioned data. I think it highlights the need for good data. The promise of analytics across the whole healthcare value chain is obviously not yet fully realized in many respects. We're in the early innings, but this one highlighted a particularly interesting aspect, which is the idea of sort of centrally collecting data to be able to predict outbreaks, predict surges, do contract tracing, and do recovery monitoring. And maybe using analytics to better understand where social vulnerability is going to be a factor and where there's likely to be problems. So I think we probably all as individuals, as well as participants in the healthcare value chain, need to kind of realize that there's a trade-off against privacy if we really want to be able to address these things well, and maybe ultimately if we want to be able to open economies back up swiftly and minimize the economic damage. So challenging time to force us to think about some tough issues.
Yeah, thanks. That was a really good comprehensive overview. Who would like to jump in on that note after John's commentary? Dirk, I see you've unmuted. Go for it.
Yeah, I think it's a very interesting topic, but I do think that with all the research that I'm seeing and reading, I honestly feel that discussion should be more about how do we define success in a crisis like this? Because I think so far we haven't actually been able to do that. I think ultimately politicians struggle to really, make the call that is ultimately going to be best for the entire population, because it will lead to some very unpopular decisions that need to be made. Because I think if you look at contact tracing and leveraging data to that extent, I think the feasibility of that, and actually the feasibility of that having impact, is very, very low, in the sense that you would need extremely high adoption rates to get any meaningful effect out of that, and then you need to integrate incredible amounts of data to be able to make a meaningful impact on how the disease would spread. And so ultimately, I think we should be making sure that we leverage all the data that we can get our hands on to get better at understanding the impact across society, and to help us make the hard decisions on ultimately how much time and effort do we want to spend on an individual COVID patient, for example, versus a patient that is now not being able to access regular care. So, I think in the Netherlands, we're seeing reduced access to healthcare for oncology patients, cardiology patients, et cetera. And we're seeing actually we're spending a lot more on, a life year gained for COVID patients than for any other patient. And I think being able to figure out that puzzle and look at that in an intelligent way will require, again, a lot of data. And it's going to ultimately help us, I think, make the right decisions for the population, because I think it's very easy to get stuck chasing a potential opportunity for a fix, but that we never actually, reach or accomplish. And I think those things are that could be true for contact tracing and also for herd immunity. I think actually ultimately a vaccine, is going to be instrumental. So until we hit that milestone, how should we base what should we base our decisions on? And I think that's where the data is really crucial. Really understanding across populations, not just the COVID patients, but also the patients that are not accessing healthcare right now. What is the impact, and how does that also go forward? Can we model on that to help us better understand what a continued lockdown would mean, for example?
Okay. So you can see I'm chomping at the bit to follow up what you were saying there, Dirk, because I think it's absolutely true that the data is the key to this. But actually, I'm more positive than you perhaps about how quickly it can be used. I think we've got real life examples right now across countries. We can see that Korea still hasn't hit a death toll of more than 300. Britain is at around 39,000. Now in Korea, because they've harnessed the data so well, and I'm sure you know this more than I do, within 10 minutes of someone being tested positive, they've got a 3-month back history of where they've been, triangulated against their credit card records, their mobile phones with their GPS tracking, and their and CCTV once they've actually located the breadcrumbs for where they've been. So in Korea, and also in China, where they're using it with the Ali Health and WeHealth systems, they're actually voluntary. Now, I certainly am going to make no claims that Chinese data is not used by the state or anything like that, but they've taken a very different philosophical view, which is that the technology is there, and particularly in Korea, as individuals, they prefer to be able to protect themselves and act together, but act as individuals for their own good and for the good of the whole, rather than be told what to do by elites. In Britain, which is, I guess, I'm based in London, so it's the easiest for me to talk about, but King's College London had an app which they launched, and people voluntarily signed up to. I think over 2.5 million people have signed up to voluntarily providing, on an anonymized basis, their phenotype data, their symptoms, and whether or not they've tested positive or not. So it's a huge example of people power, but the government is still saying, well, we're not sure whether or not we should allow this, whether or not there are privacy concerns, even where people are actually volunteering the data themselves. So although there are technology challenges, I think they're nothing compared to what this crisis has brought out, which is the real dilemma. We've all thought for a long time that governments make no difference because multinationals and technology are moving faster than governments. But actually, the one thing governments can do, and this crisis has shown us, is put the brakes on. And where they've put the brakes on, or where they've taken positive action, it's actually quite often led to more harm, or to a slowness of efficacy response. And to me, data, being able to say to people, this is what our country's figure is for a quality of life year, and here are the numbers. Now you, the voters, decide, or it's self-evident how we should allocate our resources from that information, would be wonderful. And I'm not normally a zero government man, but I have certainly seen in this instance that government and the structures around it are the limiting factor. Definitely not the technology, definitely not the life sciences.
I think, these are two separate things for me. So for me, leveraging, so of course, I'm probably the biggest proponent to leveraging data, standardizing data, making machine readable to tie into these types of models that help us make the right decisions, which for me is very different from contact tracing, which is, I would go out just for the sake of an interesting discussion and say that we cannot do in Western countries what they pulled off in China and Korea. Like there's just no way that we can do it on any level. I don't think we have the level of integration, the level of standardization, the level of sort of government owned and orchestrated sort of activities. So I think comparing us to Korea and then saying that we can replicate that level of tracing, I think it's not going to be achievable. We're going to be hitting so many roadblocks that we're constantly be chasing our tail. However, the other part is definitely something I agree with, and I would propose make sure that all the research data that's being generated is machine readable, so we can tie it into these types of models directly without having to figure out what the data means and how it's structured and how the researcher labeled all their variable names. So that's why I think it's key to make data actionable, if you will. So I'm fully supportive of that point. But I think we cannot just go country by country and say that we can do what they can do, because if you just look at comparing exchanging health data between Dutch EHR systems, for example, to what they're capable of doing in the US now, which is still also very limited. But at least in the US, we have meaningful use. We have widespread FHIR adoption. So already, between countries that are similar, that even using similar EHR systems like Epic, there's huge differences emerging that you can't just cross in 6 months or a year's time. I think we're just going to have to accept that fact, and I think in the contact tracing side, that gap is much bigger from my personal perspective. But yeah, maybe
it's an interesting debate, and we have seen during the course of this process a lot of sort of anecdotal medical practice and anecdotal sharing of evidence that led to treatment of various types of one or another, and it highlighted the importance of having better data sharing, not just across providers but throughout the system. As Dirk noted, there's already some efforts underway, and I think this will be a forcing factor there as well. The challenge typically hadn't been technology. There is some pretty decent adoption of HL7 and FHIR, but it's really more business challenge usually, is trying to incent people to be sharing data. And this highlighted the importance of solving the business problems associated with that. Funny thing though about stodgy industries and really valuable ways to leverage data, folks tend to make their way around. I've observed over the course of too many decades at this point, some of those obstacles, and find ways to use data in interesting ways. And some of the ways that you're seeing sort of temperature data and pulsimetry data and oximetry data and location data being used to do interesting things is pretty fascinating. So don't underestimate the power of a few dedicated people to overcome great odds and do interesting things. As a great author once said, that's all that ever has. And I think there's some real promise there.
I think that ties into some of, as we look at all, where our capital allocations going to be going and what companies are we really interested in backing right now too, is some ties into that of where are companies able to take an asset that they've built and, in a wartime CEO, quickly turn it into a COVID analytics, or we have a company called Title Care that does, essentially it's in a remote exam kit. It turns out in COVID, they need that inpatient. It's not for home use. They actually don't want people wasting PPE, unfortunately, going into individual rooms. So what can you do? So it's this creativity and nimbleness that we are seeing CEOs and companies come forth. And where I think, especially in the US, where we really have separated our software investing from our device investing, from our services investing, we're going to start to see the CEOs who can really bring a convergence of those and actually bring a true platform where we are going to start to need the software, the device, and the services all in one place. We're going to see more capital allocation and exciting companies coming out of that in this COVID time.
Yeah, right. Cassia, can you give us a perspective from Latin America? Let's hear a little bit, let's throw another geography in the mix.
Okay. Yeah, I think here, you see, in Latin America, we have very disparate kinds of needs. Okay, we have the public sector, which takes most part of the health sector, which we have, I think, very basic needs that we need to address. Okay, for example, especially for example in Brazil, since it's a so large country, we have challenges in terms of basic logistics of how to attend the needs of the population in remote areas. So of course, I cannot say it's a benefit from the situation, but there's a big push in enabling telehealth, which can really help attending these demands that we have all over the country. But on the other side, we have some basic challenges, as I said, in terms of how to distribute the equipment all over the country in a better way to attend the demands from locals, because there's differences on how for example, the pandemic is spreading on Brazil. We have some places that we have a large spread, and we have some kind of, let's say, good support, like for example, São Paulo. Okay, we have a large number of intensive cares, which today they are reaching their peak now, but still they're sufficient today to attend them. But when we go to the north part of the country, we lack sufficient attendance from the population. Okay, there's definitely many people dying because they don't have enough equipment and enough support or people for attending out the demand they have there. So this is one side that we see on the public sector. Okay, on the private sector, I think that there are other challenges that need to be addressed, especially on how they see the future in terms of the impact of this pandemic on all over their sector, because there's a big change on what their demands today. They have to overcome many situations that are a conflict of interests between the providers, their payers, and etc. Which are, I believe that's now it's increasing now, and we have some good startups now that are trying to address that using data as their basic source of information for trying to address all these issues within them. But still, things are, I'd say, happening faster than what they can do to attend all these demands. So that's our basic challenge. But at the same time, we see these challenges, we see many opportunities for, I'd say, companies that can create solutions to address all these issues. Okay, and as I said, we believe that new technologies can really make a difference in trying to improve all the situations in the country. And I'd say it's quite similar for other countries. We have contacts with other countries here in Latin America. They have quite similar situations as Brazil, as I said. So it's a challenging time, okay, but at the same time, we see good opportunities for any investors that are looking to invest in the health sector now.
Somebody I spoke to today called it a crisis-opportunity, which I'm not sure whether I use that word again, but it makes sense. I mean, my focus is actually not on the short term. I'm looking at the long term. You know, there'll be a tsunami of people needing, for instance, physiotherapy after this is over, well into 18 months to 2 years. So, you know, we are looking to find solutions that are going to address some of those issues. And I also think some of the issues that we understand and we know about have really been pushed to the fore by this crisis, such as obesity. You know, the countries that have had the worst death rates also have the highest rates of obesity. So we need to really start addressing these issues that are old issues but haven't had the right amount of focus on them, I don't feel. And, you know, I know lots of other people feel the same way. Things like diabetes as well. And these all fall under my umbrella of longevity and healthy aging. So, yeah, we're looking at businesses that come up with novel, innovative ways to address some of these issues. And we have, I don't know, you know, if you're aware, Innovate UK had a very large competition, a big call for SMEs at the beginning of this. We had 9,000 applicants for just 50,000 K, which is not a lot at all. And many of them, and I don't really know the statistics, but many of them were around telemedicine, telehealth, apps, virtual AI, this kind of thing. But then, you know, one of the issues that I'm coming across a lot in the healthy aging space is digital inclusion. So there are many people out there who just don't have the resources to tap into these fantastic digital solutions. So this is something else that we're really trying to focus on as well and invest in. And, you know, we really need to find some good ways to deal with those issues.
So let's talk, thanks, Helen, and let's talk a little bit about the longer term then. I mean, what do we see? We started to talk about that a little bit at the beginning, but from adaptive clinical trials, the work that's going on there to, you know, the ease of the regulatory burden for some of the emergency authorized use, not only on the product side, but also on the supply chain side. You know, we're kind of seeing some barriers being removed. What do any of you looking at those spaces and also working with others, strategic partners, collaborators to try to ensure that post this COVID period, you know, some of those will become mainstays and just continue to help ease the industry?
I'll just add one more thing from a public spending point of view and government point of view. What this has really shown us is that we can actually move really quickly. So normally a competition with Innovate UK would take many months to set up and many months to allocate the money and many months to get the money and many months to get the project going. We've got money allocated, projects starting in a 5 to 6 weeks period, which we've proved we can do it, but it needs to be something we carry on doing. And I mean, you know, fingers crossed we can do that.
Yeah, maybe one more observation related to that. This industry is, you know, not exactly heralded for fast change, at least not in the US. We're sort of the poster child for long sales cycles and slow change, and there's all these powerful systemic forces that prevent things from happening more quickly. But in the middle of this kind of thing, some interesting things happen. So in the context of sort of companies that were in a position to support the response, you know, some are in really tough spots and have to get very creative, but some are well positioned. And my favorite example is we have a company in our portfolio called Contessa Health that has a model for delivering hospital quality acute care in the home. And prompted by a partner in New York that was right in the crucible of all of this, and ultimately the White House, they adapted their model very quickly in a matter of days so that they were positioned to move non-COVID patients out of the hospital and into their homes to do the remainder of their care. And that freed up acute ICU space for COVIDs. And then ultimately, once COVIDs were stabilized, they did the same thing and moved them out into the home for hospital quality care to help them avoid, you know, not just exposing them to COVID, but to other infections generally. So if there's a lesson learned, it's despite conventional wisdom, you know, when compelled, the system actually can get comfortable with a new care model when it has to. We saw that happen in telehealth, and I think that will persist. But we also saw it in some more complex care, like home recovery care. So I think you're right. I think we have sort of an obligation and an opportunity, a crisis. What's the word again? I can't remember how you said it, but it's a fabulous word.
Crisis-unity.
Crisis-unity. Sounds very George Bushian, fabulous. But I think we have an opportunity to push harder on adopting new approaches to delivery of care that might have been institutionally challenged before.
Well, I mean, yeah, I want to. Oh, sorry, go ahead, Douglas.
Well, I think Dirk, what you were saying, Dirk, was that what is success at the end of this? And I think success is that we've actually changed, that we've moved the boulder, and people within the life sciences industry and healthcare are willing to actually take the risk of making changes and evaluating things at speed because lives are at stake. And this is the most extreme example of it. And there are 3 time periods. You know, we're funding companies now that can immediately make a difference to this. Then there are a second wave, getting things ready for September in the Northern Hemisphere. So we're partnering with MIT Solve. And Sarah, you talked about the flow of information, the number of, and you as well, Helen, the number of ideas that have come through and companies that are actually getting a voice and a hearing, which wouldn't normally do. So when you've got people like MIT in the States, you Innovate UK, and all over the world, this is happening. That's a great thing. And I just think the challenge will be actually finding a way to filter that and then get it there in the longer term. So the real long term is making sure that actually the world is better prepared for pandemics in the future. And we all know that now. It's making sure we don't forget and we can manage the information. And I'm sure, Dirk, you and your companies will be making a difference there.
Yeah, absolutely. And I think it's, I've been talking a lot about this subject, and what I think is going to be key going forward, if you look at, the regulatory agencies, what is the incentive? What is there? Is there any intrinsic motivation to innovate? Right? It's very often it's not really there because things are working as they, as they currently are. So why would the FDA be chasing a lot of change when things are working out well? Why would sponsors then try to adopt innovation if the regulators aren't, actually pushing that? So I think what is key now, even if we can't, I've been talking a lot about study continuity, right? So how do we change a current study so that it can continue to run under the current circumstances? So you can add e-consent, you can add digital enrollment, you can add remote engagement, but making changes to an existing trial that's trying to bring a drug or device to market comes with a lot of complexity. So we're seeing sort of hesitancy, even because even though the FDA is saying you are allowed to make some changes and document it well, etc., but they're not going to be big changes. But I think it's great that people are looking at that. So we see very high adoption of our e-consent technology all of a sudden. I think Perspectum, one of the companies that Blue Shield is also invested in, they actually did a study with our technology. They're one of our customers to be able to remote patients remotely, and they're also now saying, hey, we're going to adopt this across our other trials. So that's exactly the type of innovation you want to see. I think more importantly, what I think is going to happen is that the FDA and the EMA and the other regulators are going to be thinking back to this COVID crisis and be thinking this could happen again. And so for me, ultimately, that is going to be the huge differentiator, not what we can change now in this sort of a crisis time with so many different stakeholders to balance. That's going to be a real challenge to make significant change. But we're already seeing it, which is great, right? So Castor, as a big company, we really responded very rapidly, changing our product priorities, making a platform available for free, facilitating data reuse. But I think the ultimate, the big bang is going to happen when each individual regulator starts to think, you know what? If I made this decision 2 years ago, maybe we could have continued running that trial or making sure patients have access to that. And what I think is an interesting extension of that is my wife is a psychiatrist in emergency psychiatry even, and all of a sudden, she had to do a lot of what they call screen to screen, so these video conference calls with their patients. And what they're seeing is that actually, because psychiatric patients can stay in their own home environment, they actually sometimes feel more comfortable than coming into the clinic and interacting with a psychiatrist there. And so what we're seeing already is that people are saying, actually, while we thought this was impossible, this is a great opportunity because some patients are actually responding better to how we're trying to help them. And I think so all those things together ultimately will lead to definite lasting change. But I do think some things are going to be reverted. But I'm actually very positive that both on the regulatory side, on sort of the practical, pragmatic side, because people have been exposed to the innovation, they will continue to embrace it. It might not be 100%, but I think we can get close to 75%. And I think that would already be, mind-blowing. And so I really look forward to entering in that era where things slightly return to normal, but everyone has this mindset of, okay, let's not let this happen again. How do we prepare for the future?
Super. So I've been asked to have us wrap up, and I'm told there is a Q&A, but I'm not quite sure how that's going to transition. So I'm hoping somebody from Global Corporate Venturing is going to help us out here.
Well, I think there's a Q&A chat, but I haven't seen any questions. So if the audience has any questions, then they should fire them off now. But otherwise, feel we still have, what is it, 10 minutes? Or maybe I was mistaken with the timeline.
Yeah, we have 10 minutes, but we've been told to please wrap up. All right. Well, if there's no questions coming into the Q&A and we're being told to wrap up, I guess I'm just going to follow orders here on this. Thank you all for joining the panel today. It was a pleasure to meet you. Just from our conversation, I know myself, I have follow-ups I'd love to chat with you all about after this. So I hope you don't mind me reaching out. Feel free to reach out to me as well. And for all of our participants, I think you can find our information within the GCV forum, LinkedIn, contacts, etc. if you'd like to reach out to any of the panelists after this chat. So very much appreciate your contributions today, and enjoy the rest of the sessions.